Hello, how are you doing? Well, thank you very much if you're here watching my show on healthcare, especially today's show because it is relevant in India's conditions about startups, digital health, and the most important questions: why electronic medical records? So, I'm going to talk about few things today, but our format of our show is particular very important because I wanted to give you a little bit information how this show is going to happen. So I always take a very important news from internet and discuss this news and talk about pros and cons, what are the difficulties, how that news is relevant in today's perspective, especially in healthcare environment. And I try to compare it in both the environment, whether it's in India or it's in USA, depending upon what is the market of that particular news item. So last time we discussed about the acquisition of Oracle, Cerner by Oracle, and the key important point takeaway was that data is the king, and especially in healthcare, data is the king. We are going to do the same thing this time, and the news I'm going to discuss about is very simple. If you see my screen right here, the news is about Apollo Hospitals achieves 3 HIMSS Stage 6 certification. What does that mean? Okay, what does that mean, especially in India's scenario? Apollo Hospital is one of, I think it is the largest hospital chain in India. They have over 70 hospitals, over 1,200 beds. It's a large size hospital system based out of India. It's a professionally managed organization. I remember when I was living in India 25 years ago, there was one Apollo hospital in Delhi suburbs, and that's about it. And then they started, and then this entire growth in last 25 years is their commitment towards healthcare. But let's talk about what is HIMSS and what kind of certification they have achieved and what it means for people and for users. Because, so in my view, what is a medical record, or what is the purpose of building a medical record or creating a medical record, especially in digital, in a digital electronic medical record, not a medical record, electronic medical record. So the purpose behind electronic medical record should be to provide information about a patient's health and his journey electronically to physicians, to providers, to healthcare systems, and most importantly to the state. And a state means if state is paying for the health of the people, then they have a right to know about the about the conditions of the people, about the data which is generated through electronic medical records. That's how it is done in the United States. Here, 50% of healthcare insurance cost is borne by the state, which means uh, the government. Government pays for Medicare, Medicaid. At least 50% population is paid, or their healthcare bills are paid through government. So, what is medical record? What is the purpose behind medical record? And the purpose behind medical record is it's an organized way of your medical data in a digital form. And that's where the most problem lies when we talk about, and especially in the case of India, if you take an example. So let's say if this is a medical record of a patient and you are going to scan it through a scanner and put it on the computer, do you consider this as an electronic medical record? It is not. I have seen in last 20 years of my medical records career that people have been talking about medical records, even in this country, in a different time zones and with a different time span. So like 20 years ago when electronic medical records started in United States, It used to be capturing of these data points. This the form, the data which consists of this is called healthcare insurance claim form. And what it does is it provides the fundamental information about the patient, and that information goes and become a data bank. And based on that data, we can do the further analysis and we can use that data for different other purposes. But this is 50 years ago. This was launched 50 years ago in the United States to try to understand the basics of data. The basis of medical records is how you capture the data in an organized fashion, in an organized way. So when I talk about, let's go back to this news. This is what the electronic medical records means: the capturing of the medical data, not clinical, non-clinical, and the entire journey of medical records. It has to go electronically into a system, and that system should consist of certain framework. What do you mean by framework? Framework means, listen to me very carefully here. This is a standardization of healthcare technology, standardization of computers in digital health. So it doesn't mean that everybody is following their own rules, everybody is following their own idea about medical records. And that's the biggest problem right now I face. I was going through in India, especially. So I was going through the policy, IT policy of India, which was designed or developed or came into the place in 2014. You can Google it, it's right there. Most of the IT policy is not even a policy, they are just ideas. Somebody has taken those ideas from studying different systems, maybe America, Australia, Canada, USA, and they have put together an idea bank. And I don't know how somehow that has been passed in the political environment in India, but that's what the most policy consist of. They are the consist of, in India especially, this it's a heap of documents, 70, 80 pages. I printed it here. I wanted to read it. I read the whole policy. It does not give you the framework to implement medical records in an organized fashion like it is here in United States. So that is one of the biggest challenge in India when we are talking about how to implement effective electronic medical record, because India lacks a practical, uniform public policy. Practical, uniform public policy. So I'm going to come back on that, but let me talk about this particular news. Now, this news, I have read this entire news. It talks about two things. One, that the hospital has implemented electronic medical records in the entire all of their entire system. Now it doesn't talk about what are the things what are the objectives of that electronic medical records. All it talks about is they have a patient portal which basically communicates with the patient efficiently, instead of people were talking or chatting to their patients through WhatsApp and other things. The second thing it talks about is that they have a digital imaging adoption model, DIAM. And what that means is it basically stores all of your digital images in maybe a cloud format or some type of format electronically. They also talk about electronic record adoption model, which is some kind of, again, depository of your medical records. But that's not it. That's not the full medical blown up, full medical EMR system we are going to talk about in today's session. So with this news, I'm going to take you, and this is one of the latest news in the brightest hospital I'm talking about in India. There's another thing which I'm going to talk about. If you can see, I hope you can see my scene. Let me see my scene. Yes. So if you can see my scene here, the question of the day um, is why electronic medical records? Why electronic medical records? That was the question of the day. So I just explained to you, electronic medical record is not just a depository of your electronic medical data. It is a full framework which gives you enough information and data which helps providing different purposes. So like example, one purpose could be minimizing the deaths due to heart attack, or minimizing or maximizing the vaccine records, or minimizing the drug related deaths in India. So one of the main reasons why we call it the public policy is extremely important because um, when Obamacare was launched in 2008 in United States, the whole focus was on providing quality health care in United States and reducing the cost of healthcare. That was the main purpose behind the public policy. So when I talk about um, what is the startup tip of the day, I'm talking about people who are startup enthusiasts, people who wants to create some kind of healthcare startup. Here is the tip: you should always read what is the public policy of the country. Like, if there is a startup which is starting in United States, they should be reading what's there in the current public policies, and all of those public policies are, it's a public information, it's available there on CMS website in United States. Similarly, I guess there is a public policy, and I saw some documents in the government, probably the Ministry of Health in India. The biggest thing which was launched in last 10 years, or probably now 15 years, in United States was public policy around Obamacare. This policy created jobs worth $100 billion. And not only it created jobs, it also created a framework for innovation for different type of digital healthcare startups, different type of digital healthcare initiatives. Similarly, in India, right now, I'm very excited about this. In India, there is another public policy announced by the government. It's called Ayushman Bharat, and that's going to provide insurance to over 50 million people. That's what I heard, but maybe numbers can be more. And those people are going to be funded by the government for all of their medical health related issues. So that gives you a huge benefit. That gives you a huge motivation by finding what are the different ways somebody should be able to create innovation around that public policy. And I tell you, the biggest flaw in a public policy, or how you can do a public policy, the biggest flaw is having an uh, accountability, making sure that there's an accountability in the entire system, whether it's accountability of the providers, which is physicians, accountability of the systems, especially in the government system, and providing a framework for accountability is the main thrust of a public policy. So in my next session after this, I'm going to talk about how you can provide accountability and how you can read public policy in order to do some innovation in the healthcare. So the biggest flaw in implementing medical record in India is the absenteeism of a strong, solid public policy. That public policy, what exists right now, it's just a set of ideas which somebody has put together in the document and just throw it on the internet. That's what it is. 90% of that document consists the names of the people. It consists of the people who have contributed in copying and pasting that data from somewhere, from some particular nations or some other nations, which is not even relevant. So that's one of the biggest flaw. What I see and how I see it, and I think somebody should work on towards it. That how you can create a framework for digital healthcare policy, which will provide accountability from the system, accountability to the system for physicians and patients, both sides. So we are going to discuss that in a little bit time. So give me a second. Let me show you another example. Okay, so I'm going to show you, this is my famous slide. I love this slide. It tells you exactly what works in digital innovative healthcare ventures. So these are the six factors which should be aligned in any startup which you start. So this is going to be, I'm going to discuss only public policy today because that's what the topic is. And that's what I feel is very important when we talk about why the medical healthcare record is very difficult to implement in India, because they are missing a strong public policy. So public policy is a very, it's a very interesting subject because it doesn't require only the commitment from the politicians who shape the policy, but it also requires a commitment from the people at the ground level who are going to draft the policy, not only just as a document of ideas, but as a document of framework, which gives somebody an ability to innovate based on that public policy. And that's where it comes two things: technology and accountability. It is very easy to build technology in India, very easy to build technology in India. India is one of the brightest, most talented nation in the world when it comes to technology. So it's very easy to build technology in there. What is not easy to build at this moment in India is called accountability. Now, what does that accountability means? I'll give you another example of accountability. So accountability, if you see right here, which means the transparency and acceptability of the rules and laws at different level, and especially when you create a framework for something. So when you're talking about a framework, and um, you're talking about a framework and you're saying that, hey, we want to make sure um, that physicians, very simple. So let's say somebody is a very high profile physician and somebody is a very low profile physician, but they both are physicians, they both are neurosurgeons. In United States, in United States, government Medicare pays the same cost or same amount of revenue to both the physicians, no matter whether somebody sees, if he spends 15 minutes with a patient and another physician also spends 15 minutes patient, Medicare pays the same amount of rate to both the physician, irrespective of how good the other physician is. So this is called transparency. And why, how that happens, I'll tell you. Because each patient in United States, each patient data is captured through this form. Now, many years ago, that form was based on paper, but the form still exists. Now this form goes electronically to the state. Earlier, it used to go through papers. These doctors used to write the patient information in it. And what it is, it tells the state what kind of disease that patient has and what is the treatment given to that disease. These are the two critical information. And what happened is, because we have a digital framework here in United States, which is universal unified framework, every doctor has to follow that framework, and that builds the accountability. So this is what it is. These forms provide a unified platform where each doctor has to report their patients in this standard format to the state, no matter whether it's a cash based patient, it's an insurance based patient, it's an auto accident patient, whatever it is, they have to report every patient with this kind of information if they are claiming any kind of reimbursement, either from the insurance company or from the government or Medicare, Medicaid, commercial. Now, where is the standardization coming here? As I said, in United States, there's a 50% Medicare, Medicaid, or somebody who's kind of paying for your reimbursement, and 50% rest is commercial, which is private insurance payer. But they all follow the same standard. They don't have a different standards. They all follow the same kind of transparency, same kind of accountability, and same type of standardization. And that is what I meant when I said the standardization of technology is very important in any public policy. When you create that public policy at a state level means the government level. And that is the biggest flaw in Indian, right now, Indian digital healthcare policy. It is absent. The second thing which is absent from the Indian public policy, digital healthcare policy, is because there is no standardization of information and health information technology, there is totally there is no standardization which provides accountability from either of the sides. So with this, I'm going to talk about, and if anybody has any questions, we can talk about the questions. But here is an advice for startups. If you really want to innovate, and especially in digital health or digital healthcare ventures, the best thing you can do is read the public policy documents and try to find opportunities there. Most of the innovations which happen in United States are related to the public policy. And the reason I'm saying that, because public policy is the source of the information and innovation, because that gives you an ability to build solutions. So patient portal is nothing but it's one of the basics, one of the fundamental innovation in patient communication, because in the last 5 years, Obamacare, another thing which I wanted to talk about is how Obamacare has incentivized, or why Obamacare public policy was widely acceptable. So many people. So before Obamacare, the adoption of EMR in the United States was only 25%. Think about it. But right now, in last 10 years, because of Obamacare, the adoption of EMR is over 85%. So what did they do in last 8 years? So the first 4 years, what Obamacare did, and I have a slide actually for that. I don't know where did that go, but let me show you some slide, which is uh, very important slide actually. we're going to have a fantastic session at that time. So, with this, thank you very much for listening. I'm going to answer all of the questions later on LinkedIn because I don't know how to do that right now, but I'll do that. And if you have any questions, feel free to connect up with me here at LinkedIn. Outside LinkedIn, you can always send me an email. So, thank you very much.